Number 21, S-233, numéro 21, S-233.
Senator Pate.
Yes. Honourable Senators, I move that this bill be read a second time.
It is moved by the Honourable Senator Pate, seconded by the Honourable Senator D, that this bill be read a second time. On debate, Senator Pate.
Thank you, Madam Speaker. More than 50 years ago, in the report of the 1971 Special Senate Committee on Poverty, Senator Kroll and his colleagues identified that, quote, poverty is the great social issue of our time. They stated that the poor do not choose poverty, declaring it our national shame and warning us that no nation can achieve true greatness if it lacks the courage and determination to undertake the surgery necessary to remove the cancer of poverty from its body politic. They noted that we continue to pour billions of dollars every year into social assistance schemes that treat the symptoms of poverty while we leave the disease untouched. This unanswered call for action focused on pressing issues of long-term well-being for Canadians and prescribed as an urgent priority a guaranteed annual income as the first firm step in the war against poverty. The committee pressed for immediate action because it felt the poor could not be asked to wait for years for the help they so urgently need. Poverty is not inevitable, nor is it an individual failing. It is the result of government policy choices that fail to provide viable pathways out of poverty, that abandon and leave people behind. Poverty puts safety, health, and well-being at risk and undermines the values of equality, dignity, and choice to which we collectively aspire. Poverty excludes people from contributing to their communities, to their full potential, in ways that impoverish all of us. For these reasons, in terms of human, social, health, and economic well-being, it is the cost of failing to address poverty, not the cost of support measures, that Canada cannot afford. As we approach the second anniversary of the pandemic, the need to revisit the Senate's 50-year-old recommendation regarding guaranteed livable basic income is more urgent than ever. Canada is reckoning with a COVID-19 toll of illness and of death indisputably shaped and defined by income inequality, and a status quo that has allowed billionaires to amass incredible wealth at a time when millions are struggling without the economic means to stay safe and healthy, and with pandemic response measures that have yet to reach those below the poverty line in a meaningful way, despite Canada's stated intention of ensuring recovery for all. Bill S-233 would respond by implementing a framework to make a guaranteed livable basic income a reality. Canada's current approach to poverty is leaving millions behind. According to the government's own data, on the eve of this pandemic, at least 3.7 million people, that is 10% of Canadians, were struggling below the poverty line. Poverty rates are at least double that for persons with disabilities, racialized and First Nations people. Families headed by single mothers, and particularly by mothers living with a disability, are nearly 3 times more likely than average to be living in poverty. Indigenous children face poverty rates 5 times higher than the national average. Canada's policies have left 53%, more than half, of children in Indigenous communities in poverty. The pandemic exacerbated health and income inequality. During the first year of this unprecedented economic and health crisis, 47 Canadian billionaires increased their wealth by $78 billion. The International Monetary Fund, World Bank, and World Economic Forums document staggering increases in economic inequality around the world as a result of COVID-19. The pandemic has created a new billionaire every 26 hours and allowed the world's 10 richest men to double their wealth. While Canadian billionaires increased their wealth during the pandemic, too many of their companies cut or clawed back pandemic pay increases from their frontline workers. Compensation for Canada's 100 highest paid CEOs increased to an average of $10.9 million per year. For 30 of those 100 CEOs, these incredible amounts were paid out as their companies applied for and received emergency wage supplement funding from the government. In the meantime, Statistics Canada reports that low-income workers, particularly women and racialized persons, disproportionately lost jobs as a result of business closures. In Canada and around the world, women assumed additional unpaid care work, contributing to a stunning $10.8 trillion to the global economy while impoverishing themselves. COVID-19 spotlighted the vital work of caregivers in long-term care homes, too many of whom were in poverty at the start of the pandemic due to inadequate pay or working multiple jobs in order to barely make ends meet. As the pandemic made it impossible to work at different care homes, too many were left to struggle, some with no housing options other than homeless shelters. During the first year of the pandemic, 34% of African Canadians reported difficulties meeting basic household financial commitments, compared to 16% of non-racialized people. The household incomes of 31% of persons with disabilities decreased. As many as 54% of Indigenous peoples faced difficulties meeting their personal needs for shelter, food, and protective equipment. While measures like the Canada Emergency Response Benefit provided many with vitally needed economic relief, these individual supports were unavailable to anyone without $5,000 in income in the previous year. As a result, those most marginalized and most in need of assistance were left behind, abandoned to the pandemic with next to nothing in additional protections. Those who were poor stayed poor. Let us be very clear, dear colleagues. CERB did nothing for those who were poor before the pandemic and who became more vulnerable because of and during it. The unconscionable consequences of Canada's failure to address poverty and income inequality include starkly magnified, needless, and cruel exposure of people to preventable health risks. As the Public Health Agency of Canada research brings into sharp relief, one of the most shameful realities of this pandemic is that the poorest Canadians are 2 times more likely than the richest to die of COVID-19. Studies from around the world demonstrate a horrifically clear link between income and a person's risk of dying of COVID-19. In fact, when it comes to predicting COVID-19 deaths, income inequality is a clearer and more determinative indicator than even a person's age. The situation is no different in Canada. Despite this country's investments in Medicare and in the belief that no one's health should depend on their ability to pay, our eviscerated health and social care systems and economic inequality are killing people. People are dying because they cannot afford space to physically distance or to stay safe when they are ill. Mortality rates were between 2.5 and 2.8 times higher for people living in apartments compared to those living in single detached homes. Many of those at greatest risk for COVID lived in multi-generational homes or with multiple roommates in order to be able to afford rent. The situation is infinitely worse for those in congregate settings, from long-term care homes to shelters to jails, and is all the more desperate for those on the streets with nowhere safe to turn. People are dying because they cannot afford to stay home from work. Frontline workers are mostly low-paid, with limited to no benefits, and working remotely is definitely not an option. Many have to take public transit to get to work. 1 year into the pandemic, lower-income, high-immigrant, racialized, and dense neighbourhoods have been the hardest hit by COVID. For example, Scarborough, which accounts for about 5% of Ontario's population, represented about 15% of the province's COVID-19 cases. This reality is attributed in part to the number of people working multiple jobs in the most precarious forms of employment. In this fifth wave of this pandemic, health professionals continue to describe, quote, a tale of two pandemics, one lived by those who can afford to better protect themselves and one by those who cannot. Too many below the poverty line cannot afford to buy masks or tests or take time off work to get vaccines or have the means to stock up on extra food or medications to avoid multiple trips to stores. The pandemic has underscored the plight and policy imperative of meaningfully addressing the needs of low-income Canadians. Income is the #1 UN Sustainable Development Goal and the primary social determinant of health for Canadians and globally. Compared to higher income individuals, people living in poverty in Canada experience 11.3 fewer healthy years, 1.5 times the rate of infant mortality, 1.6 times the rate of unintentional injury mortality, 2.7 times the rate of suicide, 4.1 times the rate of self-reported poor mental health, 1.4 times the rate of asthma, 2 times the rate of diabetes, 1.9 times the rate of disability, 1.9 times the rate of smoking, and 1.7 times the rate of lung cancer. Health consequences are not restricted to those below the poverty line. Many more, though not in poverty, are desperately trying to keep poverty at bay. Recent polling reveals that an unprecedented 1 in 3 Canadians and 1 in 2 young Canadians are struggling with their mental health. They are fatigued, frustrated, and anxious as they navigate the inequality and instability of COVID-19. For those on the precipice, living without an adequate income, living without adequate economic, health, and social safety nets takes a dangerous toll. There is no possible excuse for our inaction. Despite the risk to individuals, to public health, and to community well-being, Canada continues to leave people in poverty and at risk of poverty. This costs us between $72 and $86 billion per year, billions in preventable health care expenses alone. Previous investments in guaranteed livable basic income tell us that Bill S-233 has the ability to help change this. In the 1970s, Manitoba's basic income pilot resulted in an 8.5 reduction in hospitalization and emergency health care costs. In Ontario's basic income pilot, 79% of participants reported improvement in overall health, 82% reported improvements in mental health, 83% were better able to afford necessary medication, 74% were better able to afford dental care, and 50% were better able to afford psychotherapy. 1/3 of participants with children reported improvements in their children's health. Many reported having to use health services less often. Bill S-233 and its sister Bill C-223 lay the groundwork for significantly improving the health and well-being of Canadians. They would result in the Minister of Finance developing and advancing a framework in consultation with Indigenous peoples and provincial, territorial, and municipal governments for implementing a national guaranteed livable basic income program. Such a program would provide direct amounts of income support sufficient to live on and would be accessible to anyone in Canada over the age of 17 below the poverty line. As a recently released briefing paper by Dr. Jim Stanford reveals, the success of the CERB underscores both the feasibility and effectiveness of income security supports such as guaranteed livable basic income. Dr. Stanford also pointed out that despite rhetoric about the CERB and other income benefits disincentivizing work, aside from anecdotal, self-interested employer testimonials, there is a decided dearth of evidence to support such assertions. While some who were in precarious part-time or gig work may have moved into more reliable work, leaving employers offering low wages or no benefits with some work shortage, the labour market is rebounding and arguably more robust, with labour force participation in late 2021 exceeding pre-pandemic peaks. Rather, as many of our colleagues more acquainted than I with business practices have pointed out, like CERB, a basic income would allow workers to not be forced to choose between starvation or homelessness or working in dangerous conditions. This provides them a chance to decommodify their lives and resist employer demands that are unfair, unsafe, or intolerable. A guaranteed livable basic income should not result in clawbacks to other services or benefits individuals receive to meet exceptional needs related to health or disability. Nor would it replace or remove the need for vital housing, social, health, education, labor, and other programs and protections. Rather, it would work to ensure that access to these measures and decision-making about how best to care for oneself, one's family, and community are not undermined by lack of money to meet basic needs. Moreover, it could be constructed so as to incentivize training and labor enhancement by eliminating current policies that interfere with the ability of too many to rebound out of poverty. Currently, those most marginalized spend whole days, years, and even lives working to access a series of oversubscribed services like food banks and shelters, as well as income programs that offer too little while subjecting people to rigid, dehumanizing, and arbitrary conditions. As reported by the National Advisory Council on Poverty, the design, requirements, and criteria of these programs too often make them particularly difficult for Indigenous peoples and other marginalized groups to access and out of touch with their needs and realities. By navigating this demoralizing system day after day, a person may receive a bare minimum to help them subsist. Such emphasis on minimum subsistence means that people are trapped at the margins, making impossible and unacceptable choices, for example, between food, medicine, or shelter, not to mention constantly on the brink of urgent need and crisis. In just one example brought to light by the research of Dr. Evelyn Forget, a single mother of two on social assistance had a plan to try to improve her employment prospects and lift herself out of poverty by taking job training. Because she was on social assistance, she required permission from a caseworker before she could do so. The otherwise supportive caseworker did not see the benefits of the woman's plan, and so instead of supporting and encouraging her initiative, the woman was not allowed to explore a pathway that could have led her and her family out of poverty. In whose interest do we plunge people into and then keep them submerged in poverty? The observations included in the 2021 report of the National Advisory Council on Poverty linked inadequate responses to poverty to the pernicious opinion that people in need are trying to abuse the system by accessing benefits. Through consultations, they heard that, quote, programs design their eligibility criteria with a focus on keeping out the cheaters. Systems place responsibility on applicants to prove their disability repeatedly, even for lifelong conditions, including an emphasis on doctor-verified diagnoses. There is a perception that resources are carefully rationed and scrutinized to ensure that each qualifying recipient has just enough to barely survive. In every province and territory, social assistance rates are wholly inadequate. They not only fall well below the poverty line, they provide between 20 to 60% less than so-called deep poverty lines. As summarized by one participant in the Advisory Council's consultations, quote, you're just trying to put food on the table and you're seen by others as cheating. It's soul-destroying. These harmful and classist attitudes about poverty are belied by the sheer amount of work and determination that go into surviving. The National Advisory Council notes that the time and effort required to navigate anti-poverty programs has turned poverty into a punitive, permanent, dead-end, full-time job. And as one Ontario disability benefit recipient noted to our office, if navigating poverty is a full-time job, the pay sucks, man. If the disability payments she qualifies for were expressed as the equivalent of an hourly wage, they would amount to less than $7, $6.74 per hour. Those on social assistance rather than disability assistance receive even less. Emergency pandemic responses like the Canada Emergency Response Benefit have risked reinforcing already powerfully ingrained stigma by drawing distinctions between workers eligible to receive supports and others who are not. This ignores, firstly, the reality that more than half of people below the poverty line have employment income as their main source of support. They are working, but not being paid enough to survive. More fundamentally, it reinforces the assumption noted by the National Advisory Council on Poverty that poverty is the result of personal failing rather than the failure of systems, labour market challenges, and government policies and programs, leading to the assumption that some are deserving and others are undeserving of help. Participants in consultations with the Council noted the expectation that people living in poverty, quote, have to be without fault in order to receive support. There is no room for them to fail or slip up. Those in poverty are held up to scrutiny in a way that no one else is. The kind of decisions that most more well-off routinely make and absorb the costs of, from buying a treat for their child to taking a personal day off work, for those in need of income assistance, are too often construed as moral failings, lack of discipline, or worse yet, laziness. Meanwhile, as the work of our colleagues Senators Down and Wetston reveal, we do not seem to apply the same critical lens when it comes to wealthy Canadians evading taxes or competition law. At its root, guaranteed livable basic income would ensure that everyone has the freedom to make choices about how best to care for themselves and their families. Let's return to Dr. Forget's example of the single mother who was trying to access job training. For her, the Manitoba Basic Income Pilot was a crucial turning point. Enrolled in the program and no longer subjected to the scrutiny of a caseworker, she now had the option of accessing enough money to give herself and her family stability while she temporarily left the labour market to pursue job training. She enrolled in training, and speaking to Dr. Forget 40 years later, she spoke about the pride she still felt at having modelled independence for her two daughters. Her experience is echoed by countless participants in Ontario's 2017 Basic Income Project. One person reported, quote, "It helped fill in the gaps when I had precarious part-time employment while looking for something more sustainable." Another person said, "I was saving for a vehicle so I could pursue self-employment without fear of not making ends meet." And another, "I was able to get the medical equipment I needed so I didn't have to leave work for my asthma." And another, "I was able to get out from under payday loans. I was able to feel dignity in living and hope for being able to maybe buy a cheap car, pay off debt, and not be looked down on by my neighbors." And another, "Even with a low employment income, I became more committed to my job serving a vulnerable population because I knew the basic income supplement would allow me to pay off all my bills and eat well." And another, "As someone who works 40 hours a week, 40 plus hours a week in a factory job that destroys my body, making next to minimum wage, I was making barely enough to get by. The basic income program helped me afford my bills and allowed me to participate in recreational activities." And another, "I had plans to go to school for all 3 years of the pilot so that when it was over, I would be in a position where I would be educated enough to get a good career. I would be in a higher tax bracket and paying more taxes so I could be contributing more to society." And another, "I was in the hospital multiple times a week with health problems from not being able to eat properly, stress, and not having a way to really go anywhere in life. I'm enrolled in schooling and I intend to go to college next year." And another, "I finally felt like part of society and not isolated, able to go out for tea when asked, pay for uncovered meds needed, sleep without anxiety. It was a feeling of confidence, of self-worth." And another, "My confidence boosted sky high. I took 2 months to get my anxiety under control. I found a full-time job in a little less than 2 months. My kids' confidence went higher. They started bringing home better grades. They have proper winter clothing, able to play outside. Basic income made me want to better myself, and I did." The access to meaningful choices afforded by guaranteed livable basic income is a matter of dignity and equality. It is also crucial to allowing people a chance to get out of what can otherwise be overwhelming cyclical chasms of poverty in ways that current social assistance programs simply do not. Bill S-233 is part of a cross-chamber collaboration with MP Leah Gazan. It builds on the momentum and decades of work of parliamentarians from diverse regions and political affiliations, drawing attention to the potential of guaranteed livable basic income as they seek to represent Canadians below the poverty line, especially during this health and economic crisis. More than 50 of us, honourable colleagues, signed joint statements and letters to the government on the issue. 3 of our Senate committees, National Finance, Social Affairs, and Human Rights, as well as the Finance Committee in the other place, have made recommendations in support of guaranteed livable basic income since the onset of the pandemic. Our former colleagues, Senators Eggleton and Siegel, worked to bring guaranteed livable basic income to the attention of this chamber long before the onset of COVID-19 through committee studies and motions. They have carried on their seemingly tireless work beyond the chamber and throughout this pandemic. MP Julie Derwitz introduced guaranteed livable basic income legislation last Parliament. 2 major political parties included this issue in their federal platforms last election. A third endorsed guaranteed livable basic income as a top priority at their policy convention. Public opinion polls indicate that significant majorities of Canadians support guaranteed livable basic income. The COVID-19 pandemic has seen unprecedented numbers of people organizing, contacting their representatives, and petitioning for urgent implementation of this measure, citing recommendations from experts in fields as diverse as the arts, banking, economics, healthcare, human rights, labor relations, social work, and the tech industry. Bill S-233 builds on Canada's past successful experiences with guaranteed livable basic income. Participants in pilots in Ontario and Manitoba reported improved health and well-being without significant work disincentives. In Manitoba, the main areas where labour market participation decreased were for teenagers who were able to complete high school instead of having to work to support their families, and parents temporarily caring for young children. Federally, Canada already counts on 2 forms of guaranteed livable basic income, the Canada Child Benefit and the Guaranteed Income Supplement for seniors, to reduce the number of young and older Canadians living in poverty in ways that contribute to the economy. According to the Canadian Centre for Economic Analysis, every $1 that the government spends on the Canada Child Benefit results in $2 of economic activity. And the economic benefits of a national guaranteed livable basic income program are predicted to similarly stimulate the economy. The Parliamentary Budget Officer has estimated the cost of a national guaranteed livable basic income program. Most recently, they provided an example of a program that would deliver $80 billion in supports for a net cost of only $3 billion by replacing tax measures like the GST credit and basic personal amount, as well as provincial and territorial social assistance. The estimate does not include future cost savings associated with downstream social and economic benefits, such as reductions in health care, criminal legal system, and emergency shelter spending. Nor does it include the potential economic benefits outlined by the Canadian Centre for Economic Analysis, including a 1.8 increase in real GDP, 346,000 additional jobs, and $52 billion in additional tax revenue after the first 5 years of the program alone. A national income-tested guaranteed livable basic income would obviously entail transition costs, but overall it is not a question of spending significantly more money. Rather, it requires us to spend more differently and more effectively. During COVID-19, the CERB and related programs have demonstrated Canada's capacity to deliver meaningful, innovative, and flexible economic supports to individuals in need. New pushes for federal involvement in guaranteed livable basic income are underway. The government has committed to introducing the Canada Disability Benefit, a form of guaranteed livable basic income for persons with disabilities. The province of Prince Edward Island is requesting federal support for a provincial guaranteed livable basic income, which would serve as a demonstration project for rollout to other interested provinces and territories. The National Action Plan for the National Inquiry into Missing and Murdered Indigenous Women and Girls includes the implementation of a National Guaranteed Livable Basic Income program as a key facet of decolonization and reversing systemic economic marginalization of Indigenous women. For years, Canada has been exploring the idea of guaranteed livable basic income and generating a wealth of compelling data about the benefits that such a program can offer. Bill S-233 would allow us to map out a national approach at a time when the imperative of eliminating poverty has never been more clear. In 1971, the members of the Special Senate Committee on Poverty presented their bold proposal for guaranteed livable basic income to Canadians as follows, quote, "To do what has to be done will certainly cost money. Lack of action will cost many times more. What inaction will cost in lost humanity is infinitely greater. The committee believes that the Canadian people are ready to face the challenge of poverty." I think so too. Canadians have been ready and waiting for more than 5 decades. It's time for us to act, honourable colleagues. Merci, miigwech, thank you.
Senator Pate, there's still 14 minutes left. We have 2 senators that would like to ask a question. Is that okay with you? Yes.
Absolutely.
Senator Forêt.
Senator Forêt, your question. Thank you, Madam Speaker, and thank you, Senator Pate, for rising to speak on behalf of the most fragile people in our society. Thank you for having explained these various programs regarding the Guaranteed Livable Basic Income. Now, I don't remember the name, but you spoke of leaders who asked to, who decided to received wage subsidies while at the same time receiving monies to raise their own salaries. Could you please remind us who these were?
I can certainly point you to the report. I don't recall all of the names of the companies offhand, but I would be happy to send that to you and to all colleagues in a follow-up. And certainly in the notes attached to my speaking notes, I've got the link, direct hyperlink to those. Certainly it was a shock to me when I mentioned some of our colleagues. It was a shock to me to find that when the 5 largest grocery chains in this country got together and decided to end the hero pay for frontline workers, that was not considered a conspiracy or contrary to competition law. That would be one example, and I certainly will be happy to provide you with more of those names. Thank you.
Senator Forêt.
Senator Forêt, do you have a follow-up question? Thank you. No.
Thank you very much, Madam Speaker. And Senator Pate, thank you very much for bringing forward this bill. As you, and I know many of us have been working on this for many, many years. So I think of the work of Evelyn Forget in trying to bring together finally the research from the Manitoba Dauphin Project. I think about the changes that have been made and the calls and some sort of patchwork from the Eggleton-Segal report. I think about the report on social assistance reform in the province of Ontario, which called for enhancement of the disability benefit and a basic income. This is over the years. I think of PEI more recently being interested in exploring this. It doesn't matter the political stripe of the government in power. Over all of these decades that we have been fighting for this, there is a hard wall, and it seems to come from the finance department. I'm not blaming bureaucrats. They have their interests and their reasons and their philosophy, ideology, whatever. I want to understand it better because I've never gotten a straight answer from, they talk about, the problems of design, but those are problems to be solved. Have you, in your discussions with the minister or the department, got any clear information about why they continue to say no and won't pursue what so many Canadians think is a much more inclusive and much more deliberately compassionate social policy?
Senator Pate.
I wish I had a clear answer for you. My answer is no, I have not received clear understanding. I've received, and hence the reason I spoke about many of the myths and stereotypes about poor people, the assertions that in fact CERB has significantly impacted the labour situation in this country, when all of the available evidence to the government and beyond reveals just the opposite. The only thing I have heard is that some have said, well, that's not the legacy project this particular government or any government was looking for. I think that's beyond regrettable. And so as we're seeing outside the doors of this chamber right now, people's frustration with their inability to navigate throughout this pandemic is rooted in the evisceration of social, economic, and health policies for decades, and then is being used, I would argue, being appropriated by some with very extreme, horrific views that are exploiting people who are very much struggling to get by. So I think it's imperative that not just the government, but all of us look at how we move forward on this. And I thank you very much for all of the work you have done historically, both in this chamber and before being in this chamber, in the work you did provincially, municipally, and throughout the country.
Senator Lankin.
Yes, briefly, I think it's time that a group of us, and perhaps some of the folks that are involved in the all-party anti-poverty caucus, because it involves people from all political parties and in the Senate from political caucus and groups, that we meet with finance officials, that we get them to spell out what their concerns are. I know that we'll hear about marginal effective tax rates. Those are design issues. They're not things that are impossible to overcome. So maybe there's a group of us that need to request a briefing, a full briefing, and a full dialogue, and I'd be happy to work with you on getting that set up. Thank you.
Repeat.
Thank you very much. I would be happy to work with you, as always, on that and many other things. So thank you. And thank you for all your work for gig workers as well. I know that that's well appreciated by me and many of the people in my circle. So thank you.
Senatrice Bellemare.
Senator Bellemare, thank you, Madam Speaker. Congratulations for your speech, Senator Pate. I think there are many ways to approach this question of a minimum wage for Canadians. It's not only through one single program, I think. And I'll take this occasion to say that we can share the same objectives, reducing poverty, integrating people into society through other avenues. The question I have regarding your speech and your approach in particular is this. You spoke several times about the report published by the Senate, the Crowell report, in 1976, and I'd like to hear you on two fundamental points of the report. The first was that the proposal for a minimum income would require a full employment policy that included a whole host of active measures to accompany people as they enter or re-enter the workforce. And the second proposal of the Crowell report was that a guaranteed basic income, and there was a section that was inaudible here, should not be proposed, but rather the age 40 plus population should be targeted for this measure. Why have young people who are 18 and older to this proposal? It would be preferable to target people who are a bit older, who have certain work experience. That's what I'd like to hear you talk about regarding this important report, the Kroll report. Senator Pate.
Thank you very much, and thank you also for all of your work, and thank you for the time you've taken to educate me about the incredible initiatives that you've been part of and the research you've done, Senator Bellemare. I think that, yes, 50 years ago, last year, when the Kroll report was tabled, it talked about a broader approach to addressing poverty. In the ensuing 50 years, we've seen the evisceration of many of the supports that were then in place that actually meant that we had certain populations at greater risk of being in poverty than we do now. And as we saw in the BC research that's been done, almost every body of research starts with a suggestion that we start somewhere and incrementally build. And in the BC model, it was women leaving violent relationships, it was people with disabilities. But when you actually read all those documents, we're not talking about getting rid of other supports. We're talking about building on and increasingly creating the kind of social, economic, and health safety nets that Canada, quite frankly, has dined out on internationally for many decades, and hasn't necessarily been worthy of that reputation for at least the past 3 or 4. And so I think it's vitally important that we look at the work that you and others, and Senator, as I mentioned, Senator Lankin, Senator Wetston, and members who are here in the chamber now, Senator Wu, and all of this work. I shouldn't start naming people because then I forget people. But, there's incredible work being done, and I think there is a great body of knowledge and expertise here that we can assist the government in moving forward on this.
Senator Bellemare, do you have a supplementary? A quick question for Senator Pate. I understand that a universal program is a very attractive idea, but I'd like to come back to the idea of measures that would target the poverty issue specifically. How did you react, Senator, to the report from the Parliamentary Budget Officer? In his second report, he showed the effects if ever we did fund a guaranteed livable basic income through our current programs. And when the results were looked at, the most affected group would see its income reduced by a guaranteed livable basic income. This group was the single parent group. They would lose more than $5,000 a year if a guaranteed livable basic income was implemented. And note that they are the second poorest group, not the most poor group. I don't know if you noticed that when you saw the report. I was somewhat surprised by this finding. For me, it was a proof that universal programs let certain customers or clients fall through the cracks. Senator Pate.
Very much, Madam Speaker. I agree, and there were facets of the costing that I certainly have questions about and have raised with the Parliamentary Budget Officer as well. But I think one correction, perhaps, is we're not talking about when we're talking about universally accessible. We're not talking about a universal basic income such as a demo grant that has been recommended by some, where it would go to everybody and then be pulled back at tax time. And the reason, when I first started looking at this some years ago, I was interested in all of these facets. But in talking to people like our colleagues, Senator Down, Senator Wetston, people who have more expertise in this, Senator Eggleton, who said, he spent his pre-Senate life or his working life as an accountant helping people with money, protect that money and hide that money. We don't want that. We also need tax reform, which I think the Parliamentary Budget Officer touched on but doesn't really go into. And then when I talked to Senator Down, and he talks about the fact that those who are hiding money offshore, and of course an issue that he is profoundly, has a ton of expertise, I have none in. He talked about the fact that we could virtually fund an initiative like this with the resources alone, the tax resources that are lost by some of those sorts of measures. Then I talked to Senator Weston, and he talks about how we need to address the money laundering issues in this country. That's why I say I'm very excited about the possibility of a number of us working on this, looking at a framework, addressing these issues, and meeting those challenges, because it's not that we should hide our heads in the sand about the very real challenges of doing this in a country as large and with as many jurisdictions as Canada, but the fact that we pretend that we're not already paying multiple billions of dollars, tens of billions, hundreds of billions of dollars to deal with not dealing with poverty, I think is where we are putting our heads in the sand. And that's what I'm suggesting we need to stop doing. We need to look at how do we actually invest those resources so they create better opportunities for everybody in this country, not just those who we, because of myths and stereotypes, judge to be deserving and those who do not.
Honourable senators, the time has expired.